Most people assume that monthly health insurance will cover ambulance rides and emergency air flights. But in the last 10 years, huge gaps have opened up in coverage. The biggest of these gaps could leave you financially vulnerable to the quickly rising costs of medical transportation. This year alone, over 30 million Americans will require emergency transportation. Afterwards, many will be surprised with outrageous medical bills. But why? And how is this happening? For one, insurance companies may only pay if your transport is considered medically necessary, and they get to decide what qualifies. 2. Even if your transport is deemed medically necessary, the provider who picks you up might be out of network. In fact, there are over 10,000 ambulance companies operating in the United States, and your health insurance plan may only cover a limited number of in-network providers. Statistics from the New York Times show that 51% of ground ambulance rides are billed by out-of-network providers. Essentially, that means you have a 50-50 chance of getting stuck with the entire bill after whatever payments are made by your insurance, if any. This process is called balance billing and refers to the variety of different ways you can end up owing large sums of money, even after insurance pays their part. 3. Let's say you are lucky enough to be transported by an in-network provider. Your trip is deemed a medical necessity, and your insurance does accept the claim. After everything is said and done, you'll still be responsible for a co-payment and deductible, which could end up costing thousands of dollars. And don't forget, these expenses occur in addition to the already high cost of medical care once you arrive at the hospital or an appropriate medical care facility. Bottom line, if you end up needing emergency transportation, there's a good chance you'll be responsible for a very large and unexpected bill afterwards. And in wide open spaces like the state of Wyoming, residents are at an even higher risk. Because trauma centers are spread so far apart, patients need to travel farther, faster, to reach the appropriate care within the golden hour. This is a term used to describe the first hour after a traumatic injury, where it is vital for the patient to receive emergency treatment. Currently, 1 out of 10 Wyoming residents will need a ground or air ambulance to reach the correct medical facility every year. That's nearly 10 times the national average, leaving you with a much higher probability of getting stuck with horrific emergency bills. But don't worry, that's where we step in. Masa MTS provides complete ground and air coverage for every ambulance company in the United States. No matter where you are or who picks you up, we eliminate your out-of-pocket expenses, including copays and deductibles. Our membership covers you, your spouse, and all dependent children under the age of 26, whether you're at home, on vacation, or anywhere within the United States and Canada. There's no claim forms and no questions about your health. Just easy, effective, and comprehensive coverage, 24 hours a day, 365 days per year. Most importantly, we offer peace of mind, protecting you, your family, and your finances from sneaky billing practices. We are Masa, and we have you covered. Any ground, any air, anywhere.